Carotid system. From the aorta, common carotid artery divide into external and internal carotid artery. Internal carotid artery moves upward, enter a canal called carotid canal, and comes out from foramen lacerum in middle cranium fossa. Above there is a dural venous sinus. Artery passes through its cavernous sinus, then anterior clinoid process, and pierces in dura mater in subarachnoid space. In orbital cavity, there is a superior orbital fissure and optic canal. Ophthalmic artery arises from the internal carotid artery near cavernous sinus, and from orbital cavity it passes through optical canal, and one branch will become central retinal artery. If there are some thrombi or clots are present in the aorta or atrium of the heart, they will come out from the valves of the heart into the circulatory system. These thrombi can be present in the internal carotid artery as plaque. They can go up to the retina and can cause blindness. Afterwards, there are two arteries coming out of the internal carotid artery. The one is called posterior communicating artery and the other one is called anterior cordial artery. Posterior communicating artery is communicating between carotid and vertebrobasilar system. Anterior cordial artery goes to the choroid plexus of the third ventricle and lateral ventricles. At last, the internal carotid artery will divide into these two parts: interior cerebral artery and middle cerebral arteries. To communicate between both sides of the internal cerebral arteries, there is an anterior communicating artery. But to unite carotid system with the vertebral system, two posterior arteries will go and join the two posterior cerebral arteries of the vertebral system. The ring consists of posterior cerebral arteries, posterior communicating arteries, interior cerebral and middle cerebral arteries, and in between them anterior cerebellar arteries. This ring is called circle of Willis. Anterior cerebral arteries move forward, then upward, and then move backward over corpus callosum. Anterior cerebral arteries give smaller arteries which are long enough to join the other part of the frontal and parietal lobe. Scullus is divided in lateral scullus, where anterior ramus, superior and posterior ramus are, and medial scullus. Middle cerebral arteries move laterally between frontal and temporal lobe, where the stem of the lateral scullus is, come out of the superlateral part of the cerebral hemisphere. On the way, medial cerebral artery will branch out couple of times and called central branches of medial cerebral artery or lenticulostrate arteries. These supply deep part of the brain, including basal ganglia, internal capsule, corpus stratum, which is chordate, and lenticular nucleus, and etc. These branches are thin and if blocked can cause hemiplegia to the opposite side of the body. In central scullus there is a motor area called precentral gyrus. First there is homunculus, then trunk, and then foot area. Homunculus is responsible for the movement in head and neck muscles. Trunk is responsible for finger and hand movement, while foot area is for foot. Foot area is supplied the blood from anterior cerebral artery. Arm and leg are supplied the blood by middle cerebral artery. Posterior cerebral artery supply blood to the temporal lobe and occipital lobe.